Hi everyone, this is Katie Rose, naturopath, coming to you from my office, Nature Medica in Tucson, Arizona. Today's topic is kind of piggybacking on last week's discussion of recurrent urinary tract infections. I got some really great feedback on that video and a couple of messages asking some other questions about urinary issues, so I thought this would be a perfect opportunity to address those. And if you know someone who's dealing with these types of issues, please share this with them, even if it's just through Messenger. I know people don't exactly want to be called out publicly for having urinary tract infections or anything of that vulnerable nature. So I totally get that, but I do appreciate any engagement. You know, the more feedback we hear from you, the more likely you are to see our posts too. So let's jump right in. Today I want to talk about interstitial cystitis, and that's kind of a mouthful, so from this point out I'm going to refer to that as IC so that I don't stumble over my words. And this is basically a chronic inflammation of the bladder. And that's what cystitis means, is bladder inflammation. Interstitial referring to that mucosal lining, the interstitium between the mucus and the underlying smooth muscle layer. And what we're dealing with here is essentially people who feel like they have a urinary tract infection all the time. You know, there's pain, there's urgency, there's frequency of urination, but when they go in and have a urine culture, no bacteria is growing on that culture. I've seen this a number of times where people have been treated as if they're having recurrent UTIs and they've been on rounds and rounds of antibiotics, but their urine keeps coming back with no bacterial growth. So if this is happening, then you definitely want to have a discussion with your doctor about a possible referral to a urologist, or if you've already been down that road and you're not getting the care that you think you need, seeing a naturopath who is literate in interstitial cystitis, or IC. You do want to make sure that you've had a urine culture. I know a lot of times people have these symptoms and they just assume it's an infection and call their doctors and say, I've got another one, and they call in a script. So this is why getting a culture is really important. You need to know what you're dealing with. This is a condition, this IC is a condition that can actually be debilitating for some people. So we're talking about pretty serious pain, and for some people they're actually prescribed opiate pain medication for this. So if we can get it under control earlier on in the process, we're less likely to have to go down that road of pain medication. And I know last week I said I had some experience with recurrent UTIs, and I have some experience with interstitial cystitis too. So I'll go a little bit more into what diagnosis looks like, what typical treatment looks like, and what you can do to sort this out on your own if you need to. Diagnosis for IC is essentially one of exclusion. So you can actually send a camera into the bladder to look for ulcerations of the bladder lining. Most women, me included, will opt not to do this unless they've tried everything else and it's not helping. Because sending a camera into the bladder does involve sending a camera through the urethra, which is also really, really uncomfortable and kind of invasive. Nobody really knows what causes IC. It could be the recurrent urinary tract infections themselves, if that's something that kind of started the process along. That can cause a little of inflammation in the bladder, possibly the repeated antibiotics and anti-inflammatories used to reduce pain. You know, if you think about what ibuprofen does to the lining of the stomach, some people could theorize that you might see something similar happen to the lining of the bladder. It could be trauma, so women who've had potential, sexual assault or a difficult childbirth might have some trauma to that area. There may be some autoimmune activity in the bladder happening, although we haven't identified antibodies for this at this point. What I'm getting at is we don't fully understand the mechanism of action here. And options for treatment in Western medicine, because of that, are pretty limited. Some of the options include using antibiotics long-term. So I know for me, one of the things that was recommended was using a medication called Macrobid, which is a common antibiotic for UTIs, for 6 months at a time, to see if that would just decrease the inflammation or reduce any remaining bacteria that could be there. Some people will recommend doing the script called AZO, which is that stuff that turns your pee like a really bright orange-red color. It essentially numbs the bladder and the urinary tract, but it can be hard on the kidneys if used long-term. And then, we talked about using heavier duty pain medications. I do know several women who've had to go that direction just to keep the pain manageable in the short term. Although, we all know that with the opiate crisis, that's something we want to avoid at all costs. And then finally, I did see a urologist who recommended doing something called DMSO as a rinse to the bladder. And it essentially is injected through the urethra into the bladder. So also kind of invasive and kind of limited evidence as to whether or not that's helpful for all women. From a holistic perspective, when I'm treating this, I really want to understand a woman's full health history, not just what the most recent symptoms are in terms of infection or pain. I want to understand if there's been any other infections in childhood, like recurrent ear infections, or in adolescence, was there acne that they were treated with a lot of antibiotics or other medications for. If you're taking certain supplements or medications, you certainly want to discuss those with your doctor so that we can understand if there's any underlying causes to your bladder inflammation. I want to know about trauma as well, and sometimes that can be uncomfortable for people to talk about, so it might not be something that's brought up in the first visit, but it's something that ultimately I do tend to be able to treat better if I know about. So what do you do if you think you have IC? If you've had recurrent bladder pain or infections and you're just not getting the results that you think are necessary from it? First, like I mentioned last week, get a urine culture. It's best first thing in the morning when the urine is most concentrated. And if you're taking certain supplements or medications, you want to make sure your doctor knows about that, just in case it's affecting the results of the culture itself. Second, you want to take a really close look at your diet. There are certain dietary triggers for a lot of women with IC. One of the triggers is oxalates in food, and I will add a link in the comments to give people a better idea of what foods are high in oxalates. Some women are also really sensitive to citrus, tomato, alcohol, coffee, tea, and chocolate. So I know with Valentine's Day coming up, that might be kind of a bummer for some of you, but it is a very real trigger for some women. Third, you really want to look at stress. Whether it's work, relationships, when we're stuck in that fight or flight mode, that sympathetic nervous system pathway, it's really hard for our muscles to relax. And when we think of what's going on in that pelvic area where the bladder lives, you've got the pelvic floor muscles. And if those are constantly in a state of contraction, that will contribute to the pain. We want to find as many ways to get in a restful, relaxed state as possible. Our bodies definitely heal better when we're in that state. Fourth, you want to find a doctor who is literate in IC. So if you're in a state where naturopaths are licensed, I would recommend seeking out a naturopath, and don't hesitate to ask them what their experience with interstitial cystitis has been. You deserve to be dealing with someone who knows what they're talking about and has treated this before. You'll definitely need some guidance as to how to heal from this. From my perspective, one of the things I'm doing is helping to heal the microbiome, because, of course, when you've had repeated rounds of antibiotics, you're really messing with all of your healthy gut bacteria. You also want to learn about how to heal your mucous membranes. So there's some great supplements that can help us do that and decrease inflammation naturally without side effects. And then, of course, healing the pelvic floor muscles, if there's been any trauma there or if they've been in a constant state of contraction. That may involve seeing a pelvic floor physical therapist at some point too. And there's some who have some great experience with helping treat interstitial cystitis pain. Finally, you want to work on practicing self-acceptance. I know this is kind of an odd thing to think about, but when I see a lot of chronic conditions, especially pain conditions, there's a really strong resistance to the pain or the disease process. It's almost like we feel as if our bodies are failing us. And the more resistance we have to that, again, the harder it is for us to overcome it. So if we can learn to accept, and I'm not talking about resignation, I'm just talking about accepting, this is where I am. I hear that there is something out of alignment in my body. It's almost as if it's a message coming through that we need to fix something. We need to go deeper. And if you stay tuned in the coming weeks, I'll have some more advice about how to practice self-acceptance in a chronic disease condition. Anyway, I think that's about all I have on this topic for today, although I could go on about it for a while, I'm sure. But thank you for listening, and if you or someone you know is suffering from bladder pain, whether it be interstitial cystitis or they don't have a diagnosis yet, please don't hesitate to share this with them somehow. As always, all of your comments and feedback and messages and shares are so appreciated, because if we don't have them, then you're less likely to see any of our information on Facebook. So thank you for engaging, and have a great day.